The main component in Ozempic and Wegovy, semaglutide, has the potential to be an effective weight loss aid and diabetes treatment. It has been described as a miracle weight loss medication for obese patients. But it only functions for as long as it is used, much like with many pharmaceuticals. What will happen exactly if you stop taking Ozempic? What will happen, and will it hurt anyone? So, to learn everything, watch the video through to the conclusion. Let us discuss the effects in detail, but before that, you should know the role of Ozempic in diabetes management. Role of Ozempic in diabetes management. It is crucial to comprehend Ozempic's function in the control of diabetes before digging into the consequences of stopping use. The medication Ozempic, which contains the active ingredient semaglutide, is categorized as a glucagon-like peptide-1 receptor agonist, GLP-1RA. GLP-1RAs speed up gastric emptying, inhibit glucagon secretion, increase satiety, and promote the release of insulin. All of these activities contribute to the control of blood sugar levels in people with type 2 diabetes. Here are a few things you could have expected after leaving Ozempic. Increases in blood sugar might happen to you. Ozempic reduces blood sugar by promoting the release of insulin. The quantity of glucose in your circulatory system may increase if you suddenly cease consuming it, particularly if you have hypoglycemia. Due to extreme tiredness from the blood sugar rises and crashes, some people may end up in the ER. As a result of these spikes, diabetic patients may have blurry vision, fatigue, and excessive hydration and urination. According to Robert Gabbay, Chief Scientific and Health Officer of the American Diabetes Association, who spoke to the Times, "You'll get hungry again." The second thing that can happen is an increase in appetite as soon as you stop Ozempic. The FDA states that Ozempic produces changes in the brain that reduce appetite and dampen the emotions of satisfaction that can be accompanied by eating. As a result, people who take Ozempic eat less since semaglutide slows absorption, keeping meals in the gastrointestinal tract longer and enhancing feelings of fullness. As a practicing plastic surgeon at Lenox Hill Hospital and Northwell Health in New York City, David Schaefer, MD, takes semaglutide. "I used to be able to eat half a pizza, but now that I'm taking semaglutide, I take a few bites and feel full," he says. "If I skip a dose, my intake rises since the feeling of fullness is lost." Negative effects will fade. Other typical adverse effects of Ozempic include nausea, dizziness, headaches, constipation, vomiting, heartburn, and gas. Not everyone suffers side effects, and for some people, they may be minor. According to Kushner, these can also be prevented or reduced by increasing the dosage of Ozempic more gradually from the lower starting dose to the greater amount generally used for continued treatment. Additionally, what you eat and how you consume matters. Kushner asserts that cutting back on dietary fat, eating fewer calories, and not missing meals can significantly reduce the likelihood of side effects. According to Kushner, those who experience side effects but continue with treatment will no longer feel them once they stop taking Ozempic. The Ozempic face will disappear. Moving to the next cause, that is the disappearance of the Ozempic face. Ozempic-induced rapid weight reduction can alter the skin and minimize fat volume throughout the body, including the face. The term Ozempic face refers to a haggard, shrunken, and drained appearance that many people lose a great deal of body weight with the Ozempic experience. A board-certified dermatologist or cosmetic surgeon can treat these alterations using injectable facial fillers. According to Joshua Zeichner, MD, a visiting professor of dermatologists at Mount Sinai Hospital in New York City, the facial alterations brought on by Ozempic can also be undone by stopping the medicine. Ozempic face will fade away if you regain back the body mass you lost from the drug, explains Dr. Zeichner. The face can restore its former fullness in the same manner that your body weight can. Not only that, but it's crucial to remember that stopping Ozempic usually doesn't result in serious withdrawal symptoms. Some people, however, can suffer minor side effects akin to those felt after taking the medicine for the first time. These possible withdrawal symptoms could include changes in appetite, diarrhea, or nausea. To monitor and treat any symptoms that develop during the stopping process, it is crucial to speak with a healthcare expert. Ozempic or any other medicine should only ever be stopped with the advice of a medical practitioner. Depending on a person's specific situation and health, they can offer tailored recommendations. To facilitate an easy adjustment and reduce potential hazards, medical advice is essential. To properly control blood sugar levels, healthcare professionals could advise gradual weaning of the medicine or offer different treatment modalities. For people with type 2 diabetes, stopping Ozempic without sufficient medical guidance can have serious consequences. Discontinuation's effects can result in uncontrolled blood sugar levels and possible consequences. Before deciding to stop taking Ozempic, it is essential to speak with a healthcare provider. If any diabetic viewers are watching us, please share your journey with us in the comments area. And if you like the video, make sure to subscribe to the channel for more interesting content.